and today I will be instructing an RT student on how to perform an ABG.
An arterial blood gas, or ABG, helps quantifiably measure a patient's pH, oxygen, and carbon dioxide levels. With these values, physicians and healthcare providers can diagnose and treat patients. ABGs are important because they provide physicians and healthcare providers clues on how well a patient's heart, lungs, and kidneys are functioning. For this instruction, our patient will be represented by this clementine. Before walking into a patient's room, make sure to grab an ABG kit. Inside the ABG kit, you will find an alcohol swab, a heparinized syringe, a specimen bag, gauze, a bandage, and a sample label. Start by walking into your patient's room and introducing yourself. After the introduction, confirm your patient's identity by asking their name and date of birth. Once you have confirmation, you can begin the ABG procedure. Make sure you are wearing gloves and begin by setting up the procedure at bedside. You will want to open up and prep all of your supplies as seen here. Make sure that your heparinized syringe is threaded securely and ready to collect your sample. Once you are all set up and ready to begin, start by performing the modified Allen's test on your patient. This test is to ensure collateral circulation. After performing the modified Allen's test, use your alcohol swab to sanitize the area for puncture. Once the area has been thoroughly sanitized, palpate your patient to locate a pulse. When you feel a pulse, keep your finger in place while grabbing your syringe with the other hand. Prepare for puncture by ensuring that your syringe is at a 45-degree angle with the bevel pointed up. Place the syringe slightly anterior to the pulse and insert the syringe when ready. Once you see a flash, stop furthering the needle. Allow the sample to fill, and once your sample has been collected, apply pressure with your gauze to the site before extracting the needle. Keep applying pressure for a moment longer before securing the site with a bandage. This completes the ABG procedure. Here are some things you should remember when performing an ABG. 1. Before puncturing your patient, you may place a folded towel under the patient's wrist to keep the wrist hyperextended. 2. Sometimes the needle passes through the artery and only a small amount of blood enters the syringe. If this happens, the needle should be slowly withdrawn until you see a pulse of blood in the syringe. This signifies that you have once again hit the artery. Lastly, if the needle needs to be redirected, it should first be withdrawn to the subcutaneous tissue while maintaining the same angle. Then you may repalpate the patient without moving the needle before redirection and reinsertion.